Hello, my name is Napa Pachantan. I'm a pharmacist from Heart Failure Clinic, Buriram Hospital. Today, I will inform you the knowledge about patients with heart failure. Heart failure is inability of the heart to keep up with the demands on it. Specifically, failure of heart to pump blood with normal efficiency. The body has an adaptive mechanism as follows: cardiac hypertrophy, vascular function changes, water and salt retention, pulmonary edema. Heart failure signs and symptoms may include very tired and hard to work, fatigue and dizziness, difficult to lay down because breathing problem, waking up at night due to breathing problem, swelling or edema in your legs, weight gain from water retention. Heart failure can be caused by several causes. Abnormality of heart such as myocardial infarction, heart attack, coronary artery disease, and high blood pressure. Alcohol drinking, using narcotic drugs, anemia and thyrotoxicosis. Risk factors include excessive drinking water, salty food, forget to take medication and use wrong medication, anemia, thyrotoxicosis, and infection. Next, we're going to talk about the self-care guide for the heart failure patient. First, the patient needs to pay attention to the signs or symptoms of hypervolemia, such as swollen feet or legs, ascites, stomach bloating, shortness of breath, and fatigue. Here is the example of feet edema. Nutrition control and food intake. A patient requires a good weight control because an increasing of weight will make heart to work harder. Avoid eating salted, fermented, canned, or instant foods such as congee cup, instant noodle. Moreover, a patient should avoid adding salt or fish sauce. Should not eat salt more than 2 grams or 1 teaspoon per day. Fluid restriction. For patients who don't have severe symptoms, may not need the fluid restriction. But in case of high fatigue patients who need to take high dose of diuretic drugs, kidney disease patient who has fluid or salt edema, the suggestions are drinking water not over 1.5 liter per day or just a big bottle per day. Fluid restriction include food, milk, juice, soy milk, or any kind of fluid. Here is the example of 1.5 liter of water or a big bottle. The patient have to quit drinking alcohol and smoking. A patient needs to get enough sleep, at least 8 hours, or take a nap 1 to 2 hours. Also reduce or avoid some hard activities or causes stress to reduce hard working. Manage a good amount of time of aerobic exercise to prevent muscular dystrophy and stimulate heart muscle. This will help a patient to work properly and actively. The exercise set may start with daily walking 1 to 5 minutes for a week, then increase to 5 minutes. The cooling down time should be 5 to 10 minutes to reduce any muscular ache. The patient needs to avoid exercise that requires high exertion, such as lifting subjects that weigh more than 10 kilograms, or if a patient is too exhausted, exercise should be stopped. Sexual activity in heart failure disease patient. If a patient able to walk 1 to 2 floors without any sign of shortness of breathing or fatigue, patients are be able to have sexual activities. However, patients need to get good rest before or after having sex and avoid too much exciting sexual activity. Moreover, a patient should avoid sexual activity after finishing meal or in the tired day. Also noted that if any abnormal sign occur after sexual activity, such as heartache, fast heartbeat, or exhausted, patient should see the doctor immediately. The medication. The patient should instantly follow the medication instruction from doctor. The dose of medication not be changed or reduced. If you run out of medication before the appointment, the patient should go see the doctor early and avoid taking any other medication with no prescription. Medicine that should be avoided in heart failure disease patients are herbal medicine, supplementary food, decoction, NSAIDs or painkillers like ibuprofen, naproxen, piroxicam, or pain reliever spray. As mentioned above, patients with heart failure need to take medication correctly and consistently. Medications used in heart failure patients are as important as medication will improve heart function. Taking medication can reduce mortality rate. Medication can reduce hospital stay. It can be seen that taking medication is very important, so patients should not miss taking medicine or should change the dose without the doctor's consideration. Next, we're going to talk about drugs that used in patients with heart failure. What kind of medicine? What are the benefits of medication? And side effects and cautions. First kind of drug is beta blocker. The drug that available in Buriram Hospital include carvedilol 6.25 mg and bisoprolol 5 mg. These drugs are used for heart failure. These drugs can reduce mortality rate, reduce rate of hospital stay, control the symptoms of heart failure, and reduce expansion of the heart. During the first 1 or 2 weeks after starting the drug or increasing the dose, patients probably have the feeling of weakness. However, the symptom will gradually improve in 1 to 2 weeks. But if you are tired even when sitting or tired to lay down, please consult doctor immediately and don't stop the medication without suggestion from the doctor. Second, angiotensin converting enzyme inhibitor or ACEI inhibitors. The drug that available in Buriram Hospital include enalapril 5 mg and 20 mg. This drug has the same benefit as beta blocker, is to reduce mortality rate, reduce rate of hospital stay, control the symptoms of heart failure, and reduce the expansion of the heart. And there are side effects that need to be concerned. Low blood pressure, especially when the gesture change may cause dizziness, so you not change position too quickly. Dry cough, muscular aches, and pain caused by high level of potassium. Therefore, avoid eating fruit with high potassium such as banana, orange, papaya. Swelling of the eyelids, lips, or face, or having a breathing problem. If you experience these, you should see the doctor as soon as possible. Third, angiotensin II receptor blocker, ARB. Angiotensin II receptor blocker in Buri Ram Hospital include Rosartan 50 mg and Rosartan 160 mg. This drug has the same benefit as beta blocker and ACEI inhibitor, and the same side effects as enalapril, except for dry cough. There are side effects that need to be concerned. Low blood pressure, especially when the gesture change, may cause dizziness, so do not move too quickly. Muscular aches and pains caused by high level of potassium. Therefore, avoid eating fruit with high potassium such as banana, orange, and papaya. Swelling of eyelids, lips, or face, or having a breathing problem. If you experience this, you should see a doctor as soon as possible. Fourth, aldosterone receptor antagonist in Buri Ram Hospital has only one drug. That is spironolactone. This drug is used for heart failure, reduce rate of hospital stay and mortality. It can also help reduce heart fibrosis as well. Side effects should be concerned. High potassium level. This may cause muscle aches and tremors, so avoid high potassium fruit such as papaya, banana, and orange. Menstrual tissue disorders in men are abnormal, or gynecomastia. The last drug is furosemide. This drug is used as diuretic to help eliminate excess water, used to reduce swelling and reduce hospital stay. The use of this drug may cause dizziness, fatigue, dry mouth, and weight loss repeatedly. Briefly, patients with a heart failure should have the following knowledge and understanding. Heart failure is a condition in which the heart cannot pump enough blood into the body. Symptoms of the disease include tiredness, hard work, a difficulty to lie down because breathing problem, leg swelling, dizziness, weight gain that increase from excess water. Causes of exacerbation include excessive drinking, mistaking medication or take the wrong medication, eating salty foods, palliative infection, and thyroid toxicity. Heart failure patients should concern the symptoms of swelling and overweight, limiting drinking water each day. Limit salt or salty foods. Do not drink alcohol. No smoking. Have enough rest and exercise properly. Take medication correctly and consistently. Do not forget to take medication and change the dose of medicine. Avoid using decoction, supplements, and herbs. When come to hospital, patients should bring the medication and heart failure patient book every time.